Hello everyone, we're the Earth's Mightiest researchers, and we believe that effective knowledge mobilization can help improve the quality of life for those living with Ehlers-Danlos Syndrome or EDS. Since EDS is a rare hereditary connective tissue disorder and those who suffer from it often don't show obvious signs or symptoms in the early stages, educating others can increase empathy towards people living with EDS and also potentially increase funding for clinical research. Screening for EDS involves a series of tests such as the Brighton score, which measures joint hypermobility on a 9-point scale, meeting the 2017 clinical criteria for EDS, and confirmation of family history through direct examinations and genetic testing. If EDS is suspected, a CT scan, MRI scan, and echocardiography may be issued to evaluate cardiovascular concerns such as mitral valve prolapse and aortic dilation. Confirming EDS also involves the use of next-generation sequencing technologies, which involves sequencing the entire genome of an organism. Diagnosis is quite important as it provides greater opportunity for more focused treatment. The method taken for diagnosis will vary depending on the patient and the EDS subtype, but can include skin biopsy, genetic testing, and DNA analysis. In a skin biopsy, findings of collagen flowers will indicate the likely presence of having EDS. In genetic testing, deficits in genes that produce collagen are examined, which will vary depending on the type of EDS. For example, classic EDS may have deficits in the COL5A1 gene. Genetic testing cannot currently be done for hypermobile EDS patients who must instead report having at least one symptoms of the following list: musculoskeletal pain in 2 or more limbs, chronic widespread pain for 3 or more months, recurrent joint dislocations, or medical confirmation of joint instability at 2 or more sites not related to trauma. EDS prognosis varies depending on the subtype of the patient. For example, hypermobile EDS patients can benefit greatly from avoiding physical straining activities like weightlifting, as this would translate to low disease morbidity. Mortality of hypermobile and classic EDS patients is typically not influenced by the disease, but for vascular EDS and kyphoscoliosis EDS patients, life expectancy can be reduced. Vascular, kyphoscoliotic, and arthrochalasia EDS patients can experience vascular and lung complications such as aortic aneurysms and pneumothorax, which can decrease one's lifespan. But even among the severe types of EDS, there are cases with good prognosis, as patients can have disease-causing gene mutations that translate to a less severe form of the disease. Since EDS is an inherited disorder, it can't be cured, but its symptoms can be treated by medications for chronic pain, physical and occupational therapy, assistive devices like braces, and even surgery to repair damaged joints and muscles. There are also lifestyle choices that can help, such as avoiding contact sports, improving sleep, and resting the jaw, among many others. And here's our works cited list.